in the question and answer session. But before we start, I would like to inform you about some technical details. So this meeting is recorded and will be published. All of you are muted because of the number of the participants, and only the panelists will be able to speak. The host will organize this. You are very welcome to use the question and answer box to ask questions addressed to the panelists, to the speakers. This is real-time captioning, so you will have possibility to have a caption, and down on the bar, or in the middle of the bar, you can see the button interpretation, and there is a possibility to have a Bulgarian interpretation. Don't be confused with the Spanish flag, because the Zoom has a limited number of languages, so it was like a compromise to use the Spanish flag, but actually this is Bulgarian translation. So all the presentations will be shared after the webinar with all of us, with all of you and everybody who is interested. Now I'm giving the floor to Eric, who is a moderator for today, and good luck.
Like this, yes. Okay, a warm welcome to all participants. There are more than 200 people participating in this webinar. We are very pleased with this guest from all over Europe to share the way of intervention services in this corona crisis situation. And, we're very pleased to have very good speakers who will inform you from real practice from different countries, from Bulgaria, from Greece, and from Albania. And they will present their experiences, but of course we will start not with the service providers, but with the parent, because the family is in the heart of the, and the families are now really feeling and living the consequences of this corona crisis in a quite severe way sometimes. And we will start this webinar with a video, and the video is an interview. It is in Bulgarian, so if you do not understand Bulgarian, you will have to switch to the English channel. And it is an interview between Borislava Cherkasova, who will later on present her presentation, and Lina Nikolova, and she is a mom of a 7-month child, and the family receives early intervention service from the organization Borislava represents, the Karin Dom Foundation in Varna, Bulgaria. So the video can be started now.
Здравейте от България, фондация Карин Дом. Днес сме поканили едно семейство, което нашия екип по ранна интервенция подкрепя още преди COVID-19. Успяхме да подкрепим това семейство и по време на COVID-19. Благодарим за включването в този важен за нас форум. За нас всички специалисти, които работят с малки деца и подкрепят семейството, е много важно да разберем как всяко едно семейство премина през последните 3 месеца, какви страхове и какви предизвикателства се срещнаха. За нас е важно също, заедно с родителите, да потърсим най-добрия начин, най-ефективния начин да адаптираме услугите си по ранна интервенция.
Sorry, there seems to be a problem with the interpretation. Perhaps we can move to the next speaker and we try and come back when the interpretation is working. Eric, is that okay?
So, sorry, can you repeat again? What did you say?
I think Eric is still mute.
Eric, there seems to be a problem with the interpretation.
Yes.
We are waiting for guidance from the EASPD technical desk.
Thank you.
Okay, Eric, can you please move to the next speaker? We will try and fix the issue with the interpretation. Thank you.
Okay. Okay. So we will. There is a problem with the translation. So we will switch now to Borislava Chekasova. She's Director Partnerships, Advocacy and Training Activities in Karin Dom Foundation in Varna, Bulgaria, and she will give a presentation called Challenges and Innovations in Time of COVID-19 for Early Childhood Intervention Services in Bulgaria. Borislava, the floor is yours.
Hello from Bulgaria and Karin Dom. Hope we can see the interview with our parent. First of all, thank you to EASPD for the invitation. I'm very glad to be here and to share the experience of our organization and how we adopted our AC services during the COVID-19 and what is our vision for the new coming reality. Now it's time of lifting anti-epidemic measures and reopening process, and this webinar is coming on time and provide us the great opportunity, each of us, to reflect our experience in the last 3 months, to share the lesson learned and to shape together the vision. But before to start, I would like to present in short Karin Dom. Karin Dom is located in Bulgaria, in East Europe, in Varna on the Black Sea, and now the summer season is coming. And from this week, and all social service providers should open gradually its services. Karin Dom offers specialized services for children from 0 to 8 years old, and the AC program is one of the main activities of Karin Dom. Our AC work with an average 65 families monthly, 40 of which the municipality of Varna financed through municipal delegated activity. When the COVID-19 started here in Bulgaria, it was declared a state of emergency on 13 March for 3 months. During this period, all AC service providers in Bulgaria should stop to work face-to-face and to transform their work to remote support. The first week was very stressful. However, our team transformed very quickly the AC support in online consultations, thanks to the close relationship and build trust with families. We managed to cover 98% of our families which we were supporting before COVID-19. And something very important, new families contact us in this period and have been enrolled in our program. What were the main challenges for the AC in Bulgaria during COVID-19? Looking back, we would put on the first place the national AC legal framework, which is at the moment in progress in Bulgaria. Definitely, this made the crisis more difficult for AC providers in Bulgaria. Just to give some details, 2 times was postponed the date of coming into force the new law for social services here in Bulgaria. And of course, this process slowed down the development of national standards, limit the relevant government support, especially in time of crisis, access to financing, access to more families and children in need. From organizational viewpoint, the biggest concern for us was how to continue to support families and children from distance in a quality way, taking into account several things: the digital gap in technology resources, the access to online communication channels, the knowledge of parents to work with their children directly. And something very important for us, one of the biggest challenges in this period for our AC team was how to support families and children with motor difficulties, without to touch, without to see the child. Actually, our physiotherapists managed this situation very creative. They used video clips explaining the exercises with their own children or demonstrating the exercises with those. As the next challenges, we would like to put the organization of remote teamwork. For the management, a big challenge was to ensure the team well-being in this period, in terms of fast-coming changes, in terms of new digital way of work. As a main goal for us was to ensure mental health, but also balance with the responsibilities at home. It means parallel to work, to take care and study with their own children. And of course, the financial health of the organization, it's a crucial time, it's a crucial in time of crisis, especially when our partners and users also have decreasing incomes. Have limited opportunities for fundraising campaign. In Bulgaria, the business during this period prioritized his donation to health sectors, hospital in fights against COVID. And if we should reflect how we handle these 4 types of challenges, we can summarize 2 lessons learned. For us, it was very useful to follow and to discuss on a weekly basis. And something very important, during this period, our decision-making process was based on 4 pillars. To be close to the family needs, but not only users, also our partners. We mean financial, institution, training partners. Team well-being, looking for new financing sources via new projects or launching new program together with partners. And of course, to continue to lead proactive advocacy activities for building AC legal framework here in Bulgaria. On next slide, I will try to give more practical view outlook how Carindom transferred his AC services. On first place, we made the design of online AC model based on user and employees' needs. Here we planned our AC consultations and parents group in online channels and time relevant to parents' needs and opportunities. We digitalized the main service processes. For example, we created and promote online Google form, online consent form for parents in order to make the whole process of services and enrollment of new users more easy. Of course, here we created a digital library to our AC consultants with resources for parents and self-education for professionals. As a second key activities during this period of transforming was for us to empower and engage parents via several steps. The team put additional efforts for mental health of parents. On first place, our AC consultants worked for decreasing the stress and anxiety of parents during our online consultation. On next place, we involved the parents in the decision-making process for child program. We designed our online consultation as a kind of parent training, how to implement the offered activities with the child at home. And something very proposed materials and tips for family environment relevant to the family needs and opportunities. And we give relevant tasks and fast follow-up feedback. As third activities, we created a set of supporting materials for parents and professionals during this time. We created free articles which were dedicated how to handle with disrupting behavior, how to communicate with our child during pandemic, how to build or change routines. Why these activities for us was very important? Because via these materials, we supported more families, not only our users. We reach Belgian families living abroad. Thanks to these materials, we built the relationship with our partners more stronger. As the next key activities during this period of transforming, we launched 2 new programs based on the new family needs and the new COVID environment. We launched online family consultation. Hand in Hands is the name of the program. The main idea was to support parents in new challenges with their children aged 0-7 years in condition of COVID and social isolation. These consultations were paid, but the price we tied to a cause. The funds raised were in support of AC services of children with special needs in Carindom, which families have financial difficulties during this period. On second place, we launched Carindom in box with materials for parents to work with children at home and something very important with instruction how to use it. The main idea here was to reach families living in places without AC services. To reach families without the necessary IT equipment or to support parents to work with their children at home. During this period, we continue our advocacy via evidence-based approach, but with focus on the effect of COVID-19 on social services and families with small children. Here we started to research with partner university. First, about effects of our online AC model during the pandemic and the effects on children and families. And the second is dedicated on effects of COVID-19 on all social service providers working in field of ECD in Bulgaria. Now, we are in front of reopening and building AC vision based on lesson learned mitigation of anti-epidemic measures. In shaping the vision for AC, our team is paying attention on 3 elements you can see on the slides. First, to make the design, to make this vision based on user feedback and based on our lesson learned during this period. To make the design in collaboration with local and national authorities and of course partners working for ACD and AC policy. And something very important, this vision should include activities for boosting government attention on AC and ACD as key priority policy areas. From this week, here in Bulgaria, all AC service providers should reopen its services. Carindom shaped this process as multi-stage. First, we will start with individual outdoor sessions and in the end of the month with group sessions. In fact, we reopen with expected from user model online plus face-to-face outdoor consultations. We will rotate on weekly basis online with face-to-face. As a recovery plan, of course, if you have a second wave of COVID-19, we are planning to start training packages for parents in ACD fields. And as well, we continue to create set of materials for parents to work at home with their children. In conclusion, our message to our AC providers is to open safely their AC services, to use the feedback of parents, and to be responsible to the health of users and their team. And then, in order to make your AC vision more sustainable, do not forget to bring the attention of the government and all authorities to make ACD and AC priority policy areas. Thank you for your attention.
Super. Thank you, Bobby. Thank you very much for this very interesting real life story and showing the innovations you as a center implemented in a very short period and using new opportunities there. I have a question for the EASPD host. Is it possible to show the film now?
Not yet. Can you please move on to the next speaker, Eric?
Okay.
Thank you.
Okay. Now, okay. We will switch now to Albania. Albania obviously faced this very similar situation as in Bulgaria. And from Albania, we have Flavia Shehu. She's a clinical psychologist and director of the ProPac Service Center of the Down Syndrome Albania Foundation. And her presentation is called Challenges and Innovations of ECI for Children with Disabilities in Albania. Flavia, please share your experiences with us.
Good afternoon, everyone. Thanks for joining us today. I'm going to share my screen. No, that is not. Okay. So today I'm going to speak about challenges and innovation of ETSI for children with disabilities in Albania, and I'm going to share our practice as Down Syndrome Albania. Just a quick overview for our main programs that we as ProPac Service Center implement. Our biggest program is the early childhood intervention. Then we have the program of academic support, and another program is independent skill courses. In each of these programs, we have specific therapies that we offer and specific courses in order to support the child. As for the ETSI and legal framework, since 2016, in the law for social care services is forecasted the early childhood intervention, and it's the first time that it's forecasted by law. But still, it's not followed with bylaws and financing. So it means that we still have to improve a lot in order to ensure everything that is needed to implement or qualify early childhood intervention. It's forecasted for children up to 8 years of age. And of course, it's forecasted to be delivered at home, institution-based or center-based. And by law, it's noted that it's based on the child and family needs, the place where the programs should be implemented. So, still, we do not have a local or national defined model, but what we did during these years is that we did the adaptations of models offered in Europe and in USA. So we try to pick our best and to implement in our country. And still there are not approved standards of ETSI, but currently Down Syndrome Albania, so our NGO, is planning to begin working with the Ministry of Health and Social Protection, but also with experts of ETSI, which are outsourced to begin outlining the standards of ETSI in Albania. What are the adapted models that we are currently using? So the first one, and the biggest one actually, is center-based model, which is offered by public services, but also private sector, which means NGO, service providers.
Социалните услуги, както и от частни предлагащи подобни услуги.
Dominant in the delivery of ETSI. Then it's home-based, which is, let's say, 90% covered by private sector, NGO, and freelancers and other service providers. But also there is a program in one of the municipality, which is a cooperation with NGO and municipality to offer this service at home, but it's just once per week, and it's not, let's say, very successful in these terms. And it's also education-based. And even here, it's the private sector that dominates, so NGOs, service providers, and freelancers. Mainly, as you can see, it's center-based, and later on I will go on with how we do it. So if we see in two different perspectives, the intervention and the professionals. If we speak about intervention, it's more discipline-based. So it's separated physical therapy, speech and language, ABA, development, etc. And as for the professionals, professionals are also discipline-based. So it's not just one ETSI expert working with a child, but there are some professionals working with the IEP of the child in order to support the child in their needs, the child and the family. As for the intervention, it's few parents involvement, which means that the parents' perspective, let's say, has to change, because most of the parents see the professionals as they have to do this, and it's, let's say, their responsibility, and they do not participate in the process a lot as we wish they could. And then the intervention itself is mostly center-based, as I mentioned before. As for the professionals, they also are discipline-based, but of course they are part of interdisciplinary team, and they work together a lot to meet the child's needs. What did we do to transform our ETSI services during COVID-19? The first thing that we did till March was the EIP adaptation and converting all the objectives that the child had to be, let's say, met at the center. We converted them on objectives to be met at home. And at the same time, we created home-based activity kits for the parents in order to support those, to complete those objectives. And then our professionals worked very close with the parents, with supervision and training of them on how to implement everything with the child. This was done by our service team, and we did another thing with our psychologist of the center, which is dedicated to parents and family dynamics, and we did the psychological support for parents in order to reduce stress and the anxiety that they were having at the time. What are the challenges of service delivery during COVID that we faced? In terms of parents, we noticed that there is a lack of training on ETSI. And then there is a lack of skills to implement the activities proposed due to non-involvement in therapy process, but also because they are not too much, let's say, into dealing with learning new skills for the child. And of course, it was another thing very important, it was the lack of resources, including didactic material or technology resources. As for the children perspective, it was very interesting actually for us, because it's this perspective of parents via professionals. Children were used to see parents as parents and not as someone with whom they are going to be seated and work and achieve something. So it was kind of a challenge in the first steps of implementing online support. Then it was disruptive behavior due to stress and anxiety, due to the change of routine at the same time, because staying at home at the time, children at our center were facing drastic change of sleep, eating, learning routine, not attending kindergarten or daycare centers. So it was everything, let's say, mirrored in their behavior. What are the steps that we are now taking toward new normality? Since 2 weeks now, we are back at the center, not with full capacity, but only with half of our children that we used to have. So we are now being protected with the new protocols and following all the rules and regulations. What we learned during this time, and that we are going to work hard on it now, is intensive parents training on early intervention. Because if we face another, let's say, wave of COVID-19, they should be prepared on how to deal with behavior of the child, how to learn new skills, and how to go on with the development of the child. And
can you finalize, please, Flavia?
Yes, and the last thing is that we are trying to push parents now toward intensive involvement in therapeutic services. Thank you.
Okay, thank you very much. Another very clear presentation from real practice. I got the good news that translation is available now for showing the film. So I propose that we will switch now to the interview between Bobby and the parent in Bulgaria.
От България.
Здравейте от България, фундация Карин Дом.
Area Foundation
Едно семейство,
have invited a
което
family
нашия екип по ранна интервенция
our
подкрепя още преди
intervention team
COVID-19.
was supporting
Успяхме да подкрепим това семейство и по време на COVID-19.
support
Благодарим за
during
включването в този важен за
So,
нас форум.
thank you for participating
За нас всички специалисти, които работят
work
с малки деца и подкрепят семейството, е много важно да разберем
to know how
всяко едно семейство
affect
премина през последните 3 месеца, какви страхове и какви предизвикателства срещнаха.
best way
За нас е важно също
action
заедно с родителите да потърсим
intervention
най-добрия начин, най-ефективен начин да
motivation
адаптираме услугите за поранна
resulting
интервенция
from
към новата реалност, която COVID-19 донесе.
reality.
Предлагам да се представите на аудиторията.
Ask you to introduce. Hello,
Майка на 2 деца,
I'm a mother of.
родени в края на 7-я месец,
They are born at the end
от град Варна.
of the 7th month.
Децата ползват
Wow.
услугите на ранна интервенция, самото раждане.
In using
Аз се свързах с
service provided
I'm
by
very sorry. I think we have to stop the video because translation is not possible to hear. Bobby, it's a real pity that we cannot hear you're talking with the mother. Can you please summarize what the mother was informing you, what she was telling you about her experiences?
So I will try in short just to summarize. But the most important thing from this interview is the vision of this mother. They're expecting in case of AC service provider open the centers to receive a mixed model of AC support. It means online plus face-to-face consultations, and she recommended to make our consultation outdoor. This is for short, and of course they assess the support during this COVID-19 situation. The most important things, the most valuable things from this support was that actually the progress of the children were protected. And of course, for the parents, the most difficult was to give the feedback as professional to our AC professionals.
Mm-hmm.
This is for short.
And may I ask you, is that something new, this relationship between parents and the professionals?
Maybe that the new channel for created channel online is assessed as valuable from the parents, and they want to use this channel in the future.
Okay, excellent. Okay, thank you very much, Bobby. So now we will switch to Agapi Papadaki. As you can hear, her name really resonates Greece, and Agapi is from Athens in Greece, and she's Program Development Manager of the Early Intervention Center for Visually Impaired Children called Ami Moni. Agapi, the floor is yours.
Thank you very much, everybody, for being here. I would like to thank the previous speakers because they have given a very comprehensive presentation of this ECI services in their country. So actually, there are not many things I have to add, but I would like to point out that there is a very clear difference between the readiness of the organizations and the state readiness and the framework, legal framework. And this is something in common that we will see in this presentation as well. So to give a little picture of Amimoni, it's a Pan-Hellenic association of parents, guardians, and friends of multiply disabled, visually impaired people. It was founded in 1993 and still remains the one and only center in Greece that serves children and adults with visual impairment and multiply disabled people. It operates 4 programs. It has a daycare center, Iris, Lilian Voudouri assisted living residence, a guest house, Polychny, for independent living for children age 8 and beyond, and the early intervention program that we will focus today. So just to give a very brief picture of the context, ECI for young children and their families enhances the child personal development, strengthens the family-owned competence, and promote the social inclusion of the child and the family. Preferably, the services should be provided in a child natural setting, preferably at a local level, with a family-oriented and interdisciplinary teamwork approach. According to UNESCO, early intervention services are considered a right for every child and the basis for sustainable human development. In Greece, it was first introduced with a Special Education Act on 2008, and unfortunately, ECI is not systematically applied in Greece. And children with disabilities, especially the ones aged from 0 to 3 years old, are not covered by a comprehensive framework, are not guaranteed equal treatment, protection from discrimination, and individualized support. Therefore, families with children with disabilities remain unsupported in terms of financial support and service provision according to the Greek legislation. But Amimoni, as well as some few other programs, addresses these needs. Specifically, Amimoni addresses the needs of visually impaired infants and young children from birth to age of 6. It is a home visiting program, and it consists of intervention with the child and caregivers, parent counseling and support. The primary goal of the intervention is to support the development, emotional well-being of the child and the caregiver-child interaction, and to promote their social inclusion. So, during the COVID, a process was designed that started with a decision to make the transition to the online services and staying at home in order to protect the children and the families, and while still offering the services. We had a previous experience on that because we were offering online services to remote areas of Greece, which was not exactly the same as in Attica, but still we had a previous experience on this, which helped a little bit to organize and schedule this process. Now, the first thing we did is that we contacted the parents and identified the challenges like lack of equipment, internet connection, computer literacy, and then we proceeded with the adaptation of the services according to the findings. So for parents, we had discussion on their thoughts, fears, ideas, guidelines and ideas, and new activities they can incorporate in the new daily life. For the child, propose activities depending on its capacity to maintain its attention on the screen. We have to remember that our visually impaired children and its psychological condition. Sometimes we choose to work directly with the child, and some others through modeling activities performed by the parent, but also sometimes was challenging, as Flavia said. So the other part was to adapt the educational material, make PPT presentation, customize to the needs of each child, high contrast objects, verbal communication to motivate the child to get involved in the activity. And we managed to have 85% of the families continuously receiving the services through telecommunication on a weekly basis. So we thought that this is a satisfying success rate since it's the first time it was implemented in the systematically provided services. So in terms of challenges, the lack of a legislative framework in Greece has some generic impact. It is related with families exposed to segmented provision of services, unsupported and unprotected population, that is the children under 3 with disabilities and their families, no certified and quantitative standards and procedures commonly approved, and the fact that existing qualitative ECI services could not be reached by parents because no prescription of the service of the official is available. So we have the impact that is related to the COVID, meaning that no state financial support seriously impacted the sustainability of the service, and no official guidelines were provided for returning to normality. This could have, this hides a very serious, sorry for this, safety hazard that we try to avoid it through internal protocols that we have created and implemented according to the legislation, of course, which was not focused to ECI services. For parents, the challenges were many, and for educators and service providers, lack of ICT literacy for both professional and educators and parents, work-life balance affected from staying at home, both for professionals and parents, parents of multiply disabled children often exhausted during lockdown, creation of activities through Skype for children with visual impairments often also created a great challenge. So we are planning for the future. For parents in order to be ready for the next period, to train them to use ICT technologies for training, support them in creating a muscle of resilience to deal with demanding conditions such as those encountered during COVID, to empower them in supporting their own child development according to each family way of living, and to enhance cooperation with the child educator to co-design and co-decide the priorities and goals of the educational plan. For the educators, ECI educators, to train them to the use of educational platforms, the creation of appropriate content, allow time and create processes from reflection, discussion, exchange of good practices among ECI professionals. To create a supportive professional environment will empower ECI educators with available consultation and resources, and to enhance cooperation with the parent, develop empathy and new advanced communication skills. For the child, to create appropriate educational material for each child's needs, to value the special condition in each family and each child, and take time to explain the new condition and give time to adapt, to connect and be present to the child's needs, and to organize a new routine to best comply with the new conditions. Now, from lessons learned,
Agapi,
yes.
your time is really already
it's the last, okay.
run out. You run out of time. So yeah.
Okay, so just for the ECI providers to connect with our service providers and share knowledge, and for decision makers to incorporate ECI service to the respective legislation for social care. Thank you very much.
Okay. Thank you, Agapi. Thank you for this nice and comprehensive presentation. Now it is time for questions and answers. We have some 10 minutes for that, and we received a few questions. When I started, I mentioned that there were 200 participants, but I was referring to the ones who registered for this webinar. But actually, we have all the time over 100 participants, and that is excellent. And we have one participant, at least one, from Chile, from South America, Rosa Pardo. Bienvenida, Rosa, en este webinar. And Rosa is asking, and it's a question for all presenters, if in your ECI programs, if you integrate also children from migrants, because she mentioned that here in Chile, the migrants is a hard topic, the migrants often have no access to this kind of programs. They have problems also because no access to computers or internet, and some of them don't even speak Spanish. So who would like to react on that? Has one of you some work with migrants? Do you have experience? Agapi?
Hello again. Very interesting question, because this is part of our scheduling. All this material, all this platform and educational tools, the online tools, make the service provision available to other people who normally do not have access to these services. As far as we are concerned, we had in the past, and we still have some. We are working together with other NGOs who are responsible for this category of families, and we are working together. And whenever there is a need for support, we introduce the service to these families, and we try. Of course, the language problem is very important, and sometimes it creates serious challenges. But we really are trying to make the information available to everybody. So this is from our country. It still needs works, and we hope that by implementing all these platforms and the online tools, we will reach even more people like that in need.
Okay, thank you, Agapi. Other experiences, maybe? Albania, Flavia?
Yes, we have only one child actually that is 2 years old now, 2.5, and is part of our center. And of course, what we did is that we we linked the family with one of the therapists that speaks his language. So they are best collaborating together for the moment.
Okay, thank you. We have a specific question for Bobby. From Bulgaria, what kind of materials you have in the package that you created for parents? What kind of materials for the parents you have?
These boxes with materials are in two categories. The first is from 0 to 2 years, and in this box we put a set of sensory materials with different kind of texture. A set with numbers, for example, to 5 or to 10. We put pictures with main steps how to cut something. We put also a small sensory bag with different materials, and what we have in this box, a flower seed. And again, pictures how this flower grow in the garden and how we should take care.
Okay.
Hope this is just I explained what we put inside,
excellent.
like idea.
Thank you. And there is another another question, and that comes from Georgia. Also, Georgia, welcome to this webinar. And that question is about what are the experiences in different countries of recovering face-to-face services? So the transition to normal. What are your experiences? Flavia, I heard you mentioning that you have now half of the children in your center. Can you elaborate a bit more?
Since 2 weeks we are back at the center based, so it was kind of hard at the beginning. What we did is that we shorted our session duration. So it used to be 55 minutes and now it's only 50 minutes because it takes more time on cleaning and preparing the room for the other child. Another thing that we are facing at the moment is to work with masks or those transparent things that we put in the place, because the child usually wants to play or to grasp the therapist. So at the same time, the therapist is working with the gloves. And these 2 weeks, it went well. So we are still expecting how it will go on. But mainly we are working with transparent things. I don't know the name, sorry.
Masks, yeah.
Masks, yeah, but not to cover the mouth because it's not possible to do this. Yeah. So this is our experience till now. We are going on with the same programs that we used to have before, but the parent now is not involved in direct therapy sessions because the parents wait outside of the center due to new protocols and regulations that parents cannot enter inside the center. So yeah, they cannot see what is happening, but they can see through the cameras, for example, but still it's not the same.
Yeah.
So yeah, for the moment, this is it.
Okay. Maybe Bobby, you also already have this, some experience?
So we started from this week, and at the moment we are preparing the environment. We prepare the protective equipment, the same as Flavia say, the same mask we are buying, the necessary materials for cleaning. But what we are thinking at the moment, we are making at the moment, we are contacting our parents to see their ability to start again face-to-face consultations, and we make two groups. One group's face-to-face outdoor, or another group is to continue just with online, because some of the parents have such
preference,
yeah, so to say, yeah. And what we are thinking at the moment, we think to use the garden of Carindom, and we organize the parents and the children in different streams, and several streams, in order to mitigate the contacts.
Okay, thank you very much. Thank you very much for the presenters. In the chat box, I see a lot of compliments entering for your presentations. Now, I would like to give the floor now to Vasilka, who will have the final words and the concluding remarks of this webinar.
Thank you, Eric. Thank you, dear colleagues. Thank you for your presentation.
I can't hear you.
Thank you for
You're muted,
sharing.
I think.
No, I'm okay.
Vasilka, we can't hear you.
I don't know why.
We can hear her.
Can you hear me?
No.
No.
Look, are you on the interpretation? Maybe just put off, but we can hear her.
Can you hear me now?
Yeah. Strange, I cannot hear you still.
I don't know why.
No. Some can hear.
Just continue
maybe
speaking.
Translation off.
Off.
Oh yeah. When you have your translation.
Can you hear me now?
Yes.
Okay. So thank you everybody for to be today with us on this interesting webinar. Thank you for the speakers sharing your experience from your countries. It is more or less the same experience in the whole region, but also in Europe. It doesn't matter in which part of the Europe. We were faced with the same situation. The challenges are the same, but the creativity of the professionals are different. So we heard different ideas how to work in our countries. So I'm really glad to that I hear some of our colleagues that start already with work face-to-face with the children. So I would like to ask all of you to be very careful and to be careful relating the safety of your work, to collaborate with the parents and to try to find the new ways of program, how to work with the parents, how to encourage them, and how to develop the ability and potential of every child. On the very end of today, webinar, I would like to remind you and to ask you to save the dates, two important dates. It is a next week webinar, Wednesday, 17th of June, the same time as usual, 2 o'clock. The topic is COVID-19, finding opportunities for non-EU members. And afterwards, it is on 25th of June. It is Thursday. It is 10 o'clock. And it is event that will be about connecting the issue with the grassroots social workers faced in their service due to COVID-19. And the European Union representatives will talk about the going forward together in supporting the social services, providers of social services. It will be very important webinar. So save the date and join us in our next webinars.
Okay, thank you very much all for attending this webinar. Goodbye, everybody. Bye-bye.
Goodbye.